Hello and Assalamu alaikum, Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper arch for implant placement. As you can see very clearly here, we've got multiple teeth. Some of them are BDRs. We'll start with the upper right 7 and 8 region. As you can see right here, this is the upper right 7. If this tooth is extracted, we'll have a ridge width of approximately 11 millimeters and a height of 7 millimeters. The upper right 8 is also grossly carious with a periapical radiolucency. The region of the 6 does not have enough bone. The region of the 5 does not have enough bone. Moving to the region of the 4, we've got an approximate ridge width of 4 millimeters and a height of 9 millimeters. Then we move towards the canine region right here. Again, very thin ridge, not very significant. 4 millimeters of width with just 11 millimeters of height. And then moving to the region of the lateral incisor right here, we've got a very thin ridge, deep, 2 quality bone, 3 millimeters of width with 12 millimeters of height. This is the central incisor. Sorry, this is the lateral incisor region. This was the canine region. My apologies. And then this is the lateral. Again, if this is extracted, we've got a periapical radiolucency, 6 millimeters of width with approximately 15 millimeters of height. In the region of the central incisor, periapical radiolucency with a buccal plate perforation, 7 millimeters of width, 16 millimeters of height. This is the central incisor on the left hand side. Doing very well, got relatively good bone here. 6 millimeters of width with only 15 millimeters of height. We've got a very big incisive canal which needs to be kept in mind. This is the lateral region, 5 millimeters of width with 15 millimeters of height. And then we go to the canine region right here. This canine is also doing no periapical radiolucencies, 6 millimeters of width, 14 millimeters of height. The first premolar region is right here. D3 quality bone, 4 millimeters of width with approximately 13 millimeters of height. And then we move to the 5. Again, good bone support overall. The tooth is doing very well as well, 8 millimeters of width with a good 10 millimeters of height. And then we move to the molar region. Again, no bone here and no bone in the 7th region. We only have a slight bit where the BDR is present, but we don't have height here. So 9 millimeters of width with only 2 millimeters of height. These are all the areas where there is a possibility of implant placement. Until and unless bone augmentation is not performed, all the implants will require further bone augmentation, and the areas where ideally we want some bone around the premolar region, so all on 6 can be given.